Hi, I am Pinar Kara. I'm a HealthPros Fellow based in Aalborg, Denmark. I work on composite indicators of quality of healthcare, and I would like to share some key findings from my studies with these indicators. First, let's start with why these indicators are relevant. Measuring quality of healthcare is important in order to assess and improve the quality of care, and to measure, to quantify the quality, we use quality indicators. However, healthcare is complex with large and increasing number of quality indicators, and it can be quite difficult and time-consuming to evaluate the quality of care based on many individual indicators. A composite indicator is basically a combination of multiple individual indicators that results in a single score. These indicators have some important advantages. However, they also come with some limitations. One of the challenges with these indicators is that there isn't a standard single approach to construct them. However, there are suggested steps to consider in order to obtain reliable composite indicators, starting with defining what we want to measure exactly with this composite indicator, and next steps will include indicator selection, weighting of individual indicators, aggregation, and validation of the final composite indicator. Some key findings from our studies using multiple databases would be, first, we see that these indicators can be very useful, especially when we have a large number of quality indicators and also healthcare providers. As an example, in a database, we have 12 quality indicators and more than 40 healthcare providers, which gives us almost 500 numbers to consider if you want to compare these healthcare providers, which is quite a difficult task, and use of composite indicators can be very useful in such cases. However, we also see that our results can be quite sensitive to the methodology that we used. There isn't a standard approach to construct these indicators, and we see that using different approaches may lead to different results, such as different hospital rankings. Therefore, careful evaluation of the construction process of the composite indicator is crucial in order to obtain reliable and robust composite indicators. Transparency, being transparent about the construction process of the composite indicator, is very important in order to avoid possible misuse of these indicators. And finally, it's very important to consider information needs of the audience. If the audience needs information on individual indicator level or just an overall picture provided by composite indicators, or maybe both of them. One of the limitations associated with composite indicators is loss of information, and it can be avoided by providing individual indicator level information along with composite indicators. This was a short overview of composite indicators and my findings. Thank you for listening.